once again. Thank you for joining Soph and me. We have with us Dr. Lipi Roy from Mass General Hospital. We are honored to have Dr. At our show today.
Thank you.
And we have Dr. Lipi talk about mindfulness and the path to good health. I am sure Soph and me and you too need that. So explain us and do introduce us to mindfulness, please.
Will do. And thank you so much for having me back. I'm so thrilled to be here to see both of you again and to talk about this topic that I find that I'm very, very passionate about. So mindfulness. Let me first share a quote from the Mind-Body Medicine Institute, the Benson Henry Institute for Mind-Body Medicine at the Massachusetts General Hospital. Their quote is that mind-body interventions have been shown to decrease the frequency and intensity of medical symptoms and improve patient disease management. So, what is mind-body medicine? Mind-body medicine is the self-care aspect of medicine that's designed to reduce stress and build resiliency, thereby promoting health and preventing disease. And mindfulness comes under mind-body medicine. And mindfulness is a state of being open, and it's a state of active and open attention to the present without judgment.
Excellent.
So, why is it that I'm bringing up mindfulness and mind-body medicine?
Right.
As I said before, mind-body medicine is the aspect of medicine that reduces stress. And stress is something that we all experience, right? People from all walks of life, all ages, all ethnicities, all professions, we all experience stress. And I bring this up especially as a doctor and a healthcare professional because studies have shown that 60 to up to 90% of all healthcare or medical visits are related to stress-induced conditions.
Wow. So what do you do? Like, well, how do you help our patients?
Yeah.
What kind of a program is it?
Yeah. So that's a great question. I'm definitely going to be talking about this, but I want to talk about how stress can really cause illness.
Mm-hmm.
So psychosocial stress, so stress in your home life, at work, at school, that can actually cause damage at the cellular level, or cellular oxidative stress is the fancy expression, and then that can lead to disease. And so stress, again, as a doctor, why am I so concerned about stress? Because stress has been shown to cause illness. And there's many, many different health conditions that are either caused or exacerbated by stress. Some of them include high blood pressure, cardiac arrhythmias, depression, anxiety, insomnia, infertility, cancer therapy side effects, and AIDS therapy side effects. So there's a lot of types of illnesses that are directly related to stress.
So do you think that causes a lot of illnesses then?
Yes,
It does.
absolutely, absolutely. And so I'm passionate about this topic. Ever since I took this comprehensive course sponsored by the Massachusetts General Hospital, Benson Henry Mind-Body Institute, sponsored also by the Harvard Medical School. It was a 5-day intense course on the revolutionary aspects of medicine and mind-body medicine, and speaking of mindfulness. So the founder of the program, his name is Dr. Herbert Benson, a wonderful, brilliant physician and researcher who coined the phrase relaxation response. And basically, the relaxation response is a physical state of deep rest that causes, that changes the physical and emotional response to stress. It's basically the opposite of the fight or flight response that our sympathetic nervous system generates whenever there's a stressful situation. So if we see a bear approaching us, we don't want to be calm and relaxed. We actually want to react and respond, right? But we don't want to be at this hyper-responsive state 24/7, right? That's not healthy. So the relaxation response brings us down to a place where it breaks the train of everyday thought. And it's powerful enough to actually reduce our heart rate, our blood pressure, and our oxygen requirements.
Wow, how related it is.
Yeah.
I'm so glad to
Yeah.
understand this. Yes.
And relaxation response is basically a tool that we can use to be able to handle stressful situations. A famous American psychologist named Dr. Abraham Maslow, he's the same gentleman that came up with the Maslow's hierarchy of needs. He came up with the expression, and I'm sure you've all heard some version of it, if all you have is a hammer, then you tend to see every problem as a nail.
Wow.
Right? So the relaxation response and mindfulness is basically a tool to help everyone, to help us all be able to handle stressful situations without overreacting and without being hyper-responsive.
So what do you do? Like, what kind of advice would you give to your patients and our viewers out there?
Yeah.
How to respond at a
Relaxation.
Yeah.
Absolutely. So great question. So there are some basic elements that are needed to elicit the relaxation response. A couple of them are being in a comfortable position. You don't want to be all tense up. You want to kind of sit comfortably. It's nice to have a quiet environment. You want to be able to have a non-judgmental and receptive awareness. You also want to have mental focus, that is repetition of a certain phrase or word or sound. And then you also want to be able to have passive return to the repetition when other thoughts intrude. So techniques that we use to utilize the relaxation response include meditation, include yoga, and repetitive prayer. There are many health benefits to the relaxation response. It can relieve some of the symptoms associated with irritable bowel syndrome, high blood pressure, chronic pain, insomnia, nausea. It also decreases pain and the use of pain medications. It can decrease anxiety and fear and decrease depression and anger. Other benefits of the relaxation response include promoting healing and recovery, increasing self-awareness, as well as increasing optimism and self-esteem and inner strength and resiliency.
So it's all about the mind. Is that what you're saying? What about food? Does that come into play also?
Yes, absolutely, absolutely. And I'm so glad you're reading my mind, so because I'm going to get to that. But I had mentioned yoga and meditation, so I just wanted to say that yoga. So that was a term that was that first appeared in the Hindu scripture, the Upanishads, over 2,400 years ago. And some of the benefits of yoga include stress reduction, improved fitness, and decreasing depression, anxiety, pain, insomnia. Yoga also reduces risk factors for chronic disease, such as high blood pressure and heart disease. And meditation. So some of the benefits of meditation, I like to break it up in terms of emotional and medical. Some of the emotional benefits of meditation include building skills to manage stress, focusing on the present, and reducing negative emotions or thoughts. And some of the medical benefits to meditation include managing symptoms related to anxiety, asthma, cancer, pain, high blood pressure, insomnia. So,
where can people get this kind of information, like how to do it themselves? Like if one of our viewers are watching, they want to know how they do go about like being less anxious, say.
Yes. So great questions. There are so many. First of all, it's easy enough to really just do at home. Even 5 minutes of just sitting in a quiet spot, relaxed, calm, and just focusing on your thoughts. Focusing on your breath, breath in and out, in and out. You know, thoughts will come in and go, come and go, come and go. That's okay, that's natural. You just kind of push them away and focus on a peaceful place, whether that be the beach, the ocean, your cottage, your parents' backyard, something calm. So that's easy enough to do, even if you could do it for 5 minutes, and then maybe over time build up to 20 minutes, 10 minutes, 20 minutes, half an hour, and then soon you'll realize that that's just who you become, somebody who's calm and relaxed in terms of how you handle everyday stresses.
So you're taking like you're trying to make sure that you do this? Like, is that what you're trying to do? Make conscious about it?
What I do is I encourage all patients, as well as my friends and colleagues, to devote 5 minutes of time to mindfulness, to meditation. But it also impacts other parts of your life. You brought up food, right? So there are so many benefits to mindfulness, and one of them is mindful eating. A very famous and well-renowned, well-respected scientist and researcher named Dr. Lillian Chung from the Harvard School of Public Health wrote a book called Savor, Mindful Eating, Mindful Living. And in it, she talks about the 7 pillars of mindful eating. And one of them is just to first honor the food. We just all take advantage of food, and we live in a culture, in a land of abundance. Another one is to engage all of your senses. Smell the food, appreciate it, touch it, feel it. A third aspect of mindful eating is be mindful of portion sizes. We're so used to having things on big plates, but if you focus on a smaller plate, then you'll actually, you won't overeat. She also talks about chewing the food that actually activates enzymes and improves digestion. And eat slowly. That helps us enjoy the food and actually eat less of it. Don't skip meals. If you skip meals, that means by the time you finally eat that next meal, you'll be hungry, it'll be the end of the day, you're tired, and then you eat more. And then lastly, she also talks about eating a plant-based diet, because many studies have shown that eating meats, particularly red meats, increase your risk of several illnesses, including things like colon cancer.
So basically, it's quality versus quantity is what you're saying.
Yes.
Once you have the quality, you can really concentrate.
Yes. But all of that goes back to stress. You know, we all lead very active and stressful lives. How easy is it for us to stop by Starbucks in the morning before we, go to work and grab a cafe latte or whatever, which is all fine, but I advocate everything in moderation rather than having, a big high calorie, soft drink or cafe or whatever 3, 4, 5 times a day. Rather, get up a little earlier, make a nice healthy breakfast, or pack something that's healthy to take to work or take to school.
Excellent suggestion.
And sometimes I often get asked to this from a lot of my patients and friends and family. Oh, Lipi, oh, doc, I just don't have time. There's so many challenges and barriers or perceived barriers. One of them is, oh, I don't have time, or, oh, my mind wanders too much, or I have too many intrusive thoughts, or I can't sit still and I can't be relaxed. And then they say, oh, whenever I try to meditate, I fall asleep. I mean, this is not unusual at all. It happens to the best of us. So please don't let that intimidate you, or that there's too many noises. There are also several misconceptions to mindfulness that I want to talk about. People sometimes think that they shouldn't have any thoughts when they meditate, and that's not true. Thoughts are natural, absolutely natural. And some other misconceptions are, oh, my body should be still and relaxed. And that's not the case. You can actually move around and fidget. The surroundings do not have to be completely quiet. And then other people have this misconception that during meditation, I shouldn't be emotional or cry or get angry or anxious. And that's not true. Sometimes emotions and feelings resurface during deep meditation. And that's actually perfectly natural.
I am perplexed. I'm sure you are. Go on, Dr. Lipi, educate us.
So I also want to, this is such an amazing area. Several very, very smart, well-educated people over the course of time have commented on this. So a very famous American philosopher, physician, and psychologist named William James said the following. He said, "The greatest discovery of my generation is that human beings, by changing the inner attitudes of their minds, can change the outer aspects of their lives. It is too bad that more people will not accept this tremendous discovery and begin living with it. But I remain hopeful that day by day, more and more people will recognize and adopt mindful practice and live and just utilize mindful practice. And the evidence is that if you think about it, there's so many yoga studios now. There's meditation courses that are offered at different workplaces, at universities, and now school children are learning about yoga, downward dog, and all these yoga poses and meditation. So it's being recognized at many levels, the important health aspects of it. So I'm quite hopeful that this is going to incorporate to everyone's day-to-day life. And I feel it's my job to really educate as many people as I can. Another quote that Abraham Lincoln many years ago said, "Most people are about as happy as they make up their minds to be."
True.
And what is he basically saying? He's saying that we determine how happy we're going to be. We determine that, not other external factors. And we determine that by dealing with the stress in our lives and determining what's going to make us happy. So I also wanted to add that there are certain characteristics of happy people. So by utilizing mindful practice and reducing the stress in our lives and leading healthier lives, we're going to lead happier lives. And there are certain key characteristics of happy people. One is that happy people appreciate themselves and others. They also don't allow negative circumstances to define them. Okay, they are less reactive and they're less regretful. They live in the moment and they live in satisfaction. And happy people perceive the world in a positive way. So
it's really the positive. You're so right. It does, with the meditation, with the positive energy.
Yeah.
This is great. And what you're trying to do is use a scientific background
Yeah.
with the mindfulness
Yeah.
to make the audience as well as me understand, which is fabulous.
Yeah, and I'm really glad you bring up the scientific basis. There's always going to be people who question this. They'll say, "Oh, that's flaky. Oh, that's never going to work." There's always going to be people who are resistant to making a change or adopting a different practice that they're not accustomed to. But I'd like to absolutely emphasize that everything that I've said so far is absolutely evidence-based. It's research-based. Individuals such as Dr. Herbert Benson and his amazing team of people at the MGH Mind Body Institute, as well as Dr. John Kabat-Zinn at UMass. People all over the country, all over the world are utilizing these techniques. So they are evidence-based. We just have to learn to slowly adopt these techniques into our own and incorporate them into our own lives. I also want to add the power of words, positive words. They are very, very powerful. Language is powerful. So when you incorporate words such as peace, generosity, friendship, gratitude, humility, awe, service into your life, it will make you a happier person and you will be mindful of your environment.
It's so true. The focus that you referred to, we have, in a day-to-day basis, we have children, we have individuals on drugs. If we put the medicine behind and we start focusing, we start meditating, we start relaxing, I think the world will be a better place.
I couldn't agree with you more. And I'm glad you also brought up the drugs. There are many people, many of my own patients, who struggle with addiction, but people don't just fall into alcohol or heroin or opiates. It's usually some type of stressor. In many of my patients, because I work at Boston Healthcare for the Homeless Program, many of my patients, they're worried about where they're going to find their next meal or where they're going to sleep. I mean, that's a chronic stressor, right? So many of them, they become depressed, they become angry and frustrated, and they will resort to maybe alcohol or other unhealthy habits. And it's not just homeless people, it's you, it's me, we all have stress in our lives. And so what I like to focus on and emphasize to people is to find tools, not just that hammer, but find other tools that you can grasp and fall back to handle the stress, rather than utilizing or depending on harmful substances or habits. Adopt helpful habits such as mindful practice, yoga, meditation, you name it. There's many techniques.
Today women are facing with so many stresses of life at different levels.
Yeah.
And yes, this is in general for every person, but women in general are really going through a lot. What would you suggest for them to wake up in the morning, be it a doc, be a a professional or a stay-at-home mom.
Yeah.
What can they do to bring that stress level down?
Yeah.
What is your suggestion?
Again, there's no one thing. There's no one thing. So what I tell people, in fact, these are things that I do myself. I lead a stressful, busy life. So I like to do things that I enjoy, that are not harmful. And so I always encourage everyone around me to focus on things that you enjoy. If that means taking a few minutes just to do some jumping jacks, or doing some sit-ups, or finding a quiet place in your home and reading your favorite magazine or favorite book with a cup of tea, tea with honey or ginger, doing some stretches, going for a walk with your dog or your kids, incorporating the family in activities. And those are some things. Spending time with people that make you a better, happier person. I spend lots of times with my friends, my family, my colleagues, people who make me a better person,
So what do you do with people who are negative, say? You try to get them out of your life?
Yeah.
Because unfortunately, we have a lot of negative people.
I'm so glad you brought that up, Soph, because it's so true. And let's be honest, like I'm far from being flawless, and there are times when I become negative, when I'm on a busy bus and people are pushing and being rude. It's hard not to get negative, So what I would say, and for all of us who have those negative experiences, just take a step back, take a deep breath. You can do that anywhere, on the bus, in your office, in the clinic, in the hospital, on the sidewalk. That's what I would encourage. As far as people who are negative, you just can't escape that. There's some people that are born into this world with their cup half full,
Yes.
and others are just half empty. They just have a negative disposition. Whereas many other people who just have a positive disposition,
Yes,
right?
exactly.
Oh yeah, definitely.
You can't necessarily change that in other people, but something that my mother always raised me with was saying that, Lipi, you can't really change other people, but you sure have control over how you conduct yourself.
Oh, definitely.
So I would encourage people not to necessarily spend time with negative people or people that bring you down.
Yes.
You can always share positive advice and recommendations, but at the end of the day, just try to avoid people who are negative.
Oh, yeah.
But
I
as
mean-
a suggestion to the negative people also, that you would say that if they took off their negativity and went to positivity,
Yeah.
they would probably be healthier,
Absolutely.
or they would live longer.
Happier, healthier, and it's tricky but there are very tactful ways of making suggestions that are not judgmental or mean. One approach that I use is, I appreciate your frustration. That does sound really frustrating and difficult. So in other words, I empathize.
Yes.
I don't say, I understand, or I totally know what you're going through, because that's disingenuous. And then I sometimes offer, well, these are some of the things I would do, or this is what I've done in the past. You might see if that works for you. That way you're not telling them what to do.
Right.
You're just offering something that worked for you.
Right.
Sometimes that'll work, and for other people, they're like, oh, what do you know? You can't change that, right?
No,
You just
very
have to
true.
realize how lucky you are and appreciate all the goodness you have in your life around you.
It's an honest question, and it's an honest answer which you provided, because you can suggest.
Absolutely.
And
That's all you can do.
Yes.
Like when you said meditation, like a lot of people also pray. Like I think
Yes.
that's a form of meditation.
It absolutely is.
And that helps a lot of people.
Absolutely.
For myself too, and for doing
I-
yoga
Yeah.
and praying. I think
the deep breath
with-
that she was referring to, back in South Asia, we call it pranayam.
Mm-hmm.
So you take in from one nose, you take out from the other, then you take in from both, and we've learned this, but we just learned it as just learning, but today as a doctor, and we are practicing it.
Yeah.
Yes,
Yeah.
with science as a background.
Yeah, I'm glad you brought that up, because yoga, meditation, these practices are not new. They've been around for centuries from our Asian ancestors. They've been doing this for a long, long time. We here in the West like to have evidence for everything. But we have plenty now of evidence to show that yoga and meditation, mindful practice, really makes us better, healthier, and happier people.
So there's always been the problem then, stress, because if it was done at that time,
Yeah.
I'm sure it was to relate to, like being not stressful.
I mean, imagine, back centuries ago, they had stress as well, right? They didn't
Exactly.
have- their stresses were, oh, my iPhone's not working. They had other stresses like, oh, where am I going to find food? Oh, there's a drought. My trees and plants aren't growing. You name it, right? There's always, stress will never go away. We just have to learn a way of how to deal with the stress.
That's such a wonderful show we have today, and you have incorporated science, religious practices that has been happened for ages ago, and we hope to see you again in our next show with a corresponding, mind and the healthy way of life. And thank you once again for joining us, Eshita.
This is so. Thank you.
Thank you.
Thank you.
Bye.
Okay.